Hi, this is Dr. Mohammed. What I want to talk about is ear infections. And this is one of the things that it's hard for someone to understand. Why are you going to come to a chiropractor? Because your ears are hurting. Why are you going to bring your child to a chiropractor? Why your ears are hurting. This is one of these things that's very kind of hard to explain. It's very easy to explain if you have a headache. While you're adjusting the neck, I can show you the nerve pathways, the structural problems, how it's going to correct that for the headache or for your neck pain. But an earache, when the child, when someone has an ear infection, the ear's hurting, getting adjusted, especially in the upper part of their neck, it really changes the anatomy inside of your neck, and it really causes a decrease in pain. Inside of your ears, if you could just imagine, you have your ear, you have your eardrum, and inside you have something called a eustachian tube, and that's a very thin, very flexible tube that goes in the back of your ears and it drains into your throat. If this tube is blocked or clogged, it's going to cause a pressure buildup inside of your ears, and you're going to have an earache. Adjusting the upper part of your neck and even the whole neck, it really releases a lot of that pressure and it decreases the pain. Now I'm going to tell you this from personal experience. My two older daughters, when they were younger, I was not a chiropractor. I was a soldier in the army, and they would get ear infections all the time. And what I would do, someone who was a soldier, I would take them to the medical base. They would give them some antibiotics. A couple days later, they'll feel better, and this would happen several times a year. Constantly, oh, their ears hurting again. Take them over there and get the antibiotics in a pink bottle, and give them that every 3 to 4 hours. And that's just what we've done. Now, as I went to chiropractic school, the rest of my kids, as soon as they have an ear infection, the ears is hurting, I would adjust them. My two older kids, they got a lot of that pink medication. The rest of my kids got it 0 times. Why did they get it 0 times? Because every time the ears started hurting, I would adjust them. My grandkids, as soon as the ears start hurting, I would adjust them right away. So from very personal experience, I'm telling you, and getting adjusted for an ear infection works fantastic. Not only my kids, any other kids come to the office, they have ear infections, I do the same thing. And most of the time, 80% of the time, 85% of the time, the pain in the ears goes away right away. If you have any question about this, leave me a comment and I'll get back to you. This is Dr. Mohammed.